Hi, my name is Jessica and this is Dylan, and today we're going to be talking about Prader-Willi Syndrome. I will also be referring to this as PWS throughout the remainder of the video, but Dylan is going to ask me a few questions and then I'm going to give you guys a rundown of what exactly PWS is so we can learn more about it. So Dylan, what is your first question?
Yeah, what is Prader-Willi Syndrome, and could you give me an overview of what PWS is?
Yes, I can absolutely do that. So PWS is a genetic condition that presents in infancy with severe hypotonia, which is low muscle tone, feeding difficulties, and delayed growth milestones. This can lead to developmental delays, cognitive impairments, and severe behavioral problems, such as stubbornness, being very controlling, having temper tantrums, and then having obsessive compulsive tendencies. People with PWS are also very commonly known for their extreme hunger. So the cause of PWS, one of three things has occurred regarding chromosome 15. So 1, the paternal genes on chromosome 15 are not present. 2 copies of chromosome 15 are received from the mother and none from the father. Or 3, there is an error or defect in the paternal genes on chromosome 15. So one of these three things has happened for someone to have PWS. Some impact on the body and on occupations. PWS results in very low muscle tone, as I stated earlier, which makes it very difficult for children and adults to engage in many occupations that may be meaningful to them or become fatigued very easily when engaging in those occupations. It can cause abnormalities in sleep and cause people to never know when they are full, which means if they don't have anyone to supervise or stop them, they will not stop eating. This can lead to morbid obesity, and that can cause them to need additional help doing things like bathing, dressing, walking, etc. Difficulty feeding and hyperphagia, which is overeating, does occur with PWS, and due to overeating, people with PWS cannot live independently. They need to have they always need to have supervision so they do not overeat to the point where they could die from it or become morbidly obese and become immobile and need someone to assist them with doing daily tasks that they need to do. It can disrupt typical sleep cycles, and sleep apnea is also a common occurrence, which is when your breathing pauses during your sleep. In nearly all cases, infertility occurs from underdeveloped sex organs, and that is something that can severely impact someone if they grow up wanting to carry a child or be able to do that. So walking and sitting up independently can also be delayed, as well as delayed speech and articulating words could be a challenge for people with PWS, which makes communicating their wants and needs very difficult. Some typical characteristics of PWS include very fair skin, which is called hypopigmentation, underdeveloped genitals, a short stature, some issues with their eyes that can cause low vision, scoliosis, very small hands and feet, and then very distinctive facial features such as a narrow forehead, almond-shaped eyes, and a triangular mouth. A typical course of action: the earlier the diagnosis, the more able they are to kind of manage the symptoms of PWS. There are a lot of professionals that do become involved in these cases, such as the primary care physician, an OT, PT, speech, and also a dietitian to kind of make sure that they're getting the nutrients they need while also not overeating. Children can also be started on growth hormone treatment, and they do typically have a more improved quality of life as it helps increase their cognitive skills, motor performance, feeding abilities. It helps normalize their height, increases their mobility, and then it also decreases their fat mass. So some precautions that you need to take when you are working with someone that has PWS. People with PWS need to be supervised, as I've said, and extreme measures such as restricting food, locking up places where you may store food and keeping it away from them and where they can't get to it needs to occur so they do not overeat. And then the typical prognosis, they typically do make it to adulthood, and they can do a lot of things that people without PWS can, such as go to school, get a job, and participate in things that they're interested in. However, they do require a lot of support as well as a lot of supervision, again, in regards to food. And those that suffer from morbid obesity and severe behavioral or psychological difficulties that do go untreated may have a shorter life expectancy as well as decreased quality of life. So what are your other questions?
Oh yeah, what are some red flags?
Red flags. Okay, so some red flags that you need to look out for. Again, any excess food or additional food that is around, you want to keep that out of their reach. You do not want them to overeat, as that could have severe medical impacts on them. If they have difficulty speaking or articulating their speech, it may be difficult for them to express when something is wrong or if they need something. So you need to recognize signs of distress or when they're becoming overwhelmed or anxious. And then they're more likely to have behavioral problems. So especially when denied food, they can throw temper tantrums and even be very manipulative and controlling. So they may also display obsessive compulsive tendencies, such as picking at their skin. So you need to be on the lookout for that and recognize kind of when they're anxious and upset, so they're not harming themselves or harming others.
Are there interventions that you as OTs can do?
Yes, there are so many interventions that we can do as OTs. So some things like adaptive strategies to help with improved coordination and walking, educational workshops to inform communities, schools, and others about PWS and how to best support those that have it so they can thrive. And then acquisitional interventions such as acquiring and maintaining increased muscle tone and strength, and then working with emotional regulation as well as social skills. And then also rope practice and exercise can help increase their strength since they do have that low muscle tone.
What are some occupational impacts that can result from PWS?
So some occupational impacts that we can be working with them on, working with clients on their emotional regulation, higher level cognitive functions like planning and executive functioning, as well as working on appropriate social skills and how to follow directions and stay on task are typical occupational areas that you can work with people with PWS on so you can help them engage in occupations more appropriately and successfully. Do you have any other questions?
No, that's it.
Awesome. Okay, well, thank you guys for learning about PWS with us. Dylan, thank you for your questions. And I hope that you've walked away with a better understanding of what PWS is and how you can better support them so they can thrive.
Absolutely.
Thank you.